Good afternoon. Hi, everybody. It's Lillian here from the Health Center. I just wanted to give you a quick update on the COVID-19 situation here on the nation. Quite honestly, I had hoped not to have to do another one of these podcasts ever again, but here I am. And so I want to give you the most up-to-date information that I can. To date, we have a total of 7 active cases here on the nation. Of those cases, I would say 99% of them are unvaccinated. So I am here to make an appeal to you to please come in and get your vaccinations done. If we look at our little heart of Bonnyville MD here, Bonnyville MD is posting 254 active cases for the MD of Bonnyville. Our little city of Cold Lake has 131 active cases. We currently have the second highest rate of infection in the entire country. So the only one who has surpassed our rate of infection right now is Wood Buffalo, the MD of Wood Buffalo. Because of this, I want to make an appeal to you, as well as with the increasing hospitalization and transmission rates. Those are mostly among the unvaccinated in Alberta right now. We do have some breakthrough cases, but those breakthrough cases are happening with people who are immune compromised. Those people who are vaccinated do not suffer from severe complications of COVID. They do not get hospitalized. So I appeal to you to please do not wait until it's too late and come in and get your vaccination done. For new restrictions that came forward on September 4th, as Dr. Henshaw had come out with some new masking mandates. I'm just going to read through those right now. So mandatory restrictions effective September 4th. Masks are mandatory in all indoor public spaces or workplaces. Employees must mask in all indoor work settings except while working alone at their own workstations. Schools are not required to implement masking. However, school boards may continue to manage their schools as they see fit, and I highly encourage, if you are able to wear a mask or if your child is able to wear a mask, to do so. Alcohol services in restaurants and in our public sector must end at 10 p.m. in all licensed establishments. Albertans are encouraged to limit all in-person contacts. Unvaccinated Albertans are strongly recommended to limit indoor social gatherings to close contacts to only 2 cohort families to a maximum of 10 individuals. So I'm going to repeat that again. If you are unvaccinated, please limit your indoor social gatherings to those who are in your household and only to 2 cohort families to a maximum of 10 people. Employers are recommended to continue work from home measures where possible. If employees are working on location, they must mask in that indoor setting at all times. COVID-19 testing for Albertans with symptoms remains in place and remains available at our health center. And I highly encourage you, if you are suffering from any symptoms whatsoever, please give us a call and get in and get tested. But more importantly, if you're sick, stay home, okay? Do not go out into the workplace. Do not go into social gatherings or public gatherings. Stay home, please. Isolation is still legally required for people who have COVID-19 symptoms, as well as those who test positive. Quarantine is no longer legally required for close contacts of positive cases. However, that being said, with our case rate in this region, please use common sense. If you are a contact to a positive COVID-19 case, please give us a call. We can assess that risk, test you if we need to test you, and quarantine you until those test results come in. Isolation hotels and quarantine supports are no longer available in Alberta. So I appeal to all of you. We have been through this for 18 months. Please ensure that your cupboards are well stocked and that you have food at home so that if you develop symptoms, we don't have to worry about groceries and having to get people to drop stuff off for you. Please make sure that your grocery and your cupboards are full and that you have the ability to isolate at home for at least 10 days. Individuals with a positive COVID-19 test will be notified. So when we get a positive test result at our healthcare center, we call and we notify you. Alberta Health also notifies you, usually via text message. Contact tracers no longer notify your contacts. Okay, this has been a change in Alberta. However, that being said, we will offer to contact your contacts if you are unable to do so. So if you can share with us your contacts information, then we will gladly reach out to them. Okay. So here in Alberta, Albertans are encouraged to assess and manage their personal risk. It is reasonable for people to continue using precautions that serve their needs. So when you're assessing your personal risk, some of the risk factors that you need to take into account. So it's important for you to consider that factors that increase your COVID-19 risk of infection is the fact that you are not fully vaccinated. If you regularly interact with children 11 years of age and under who cannot yet be vaccinated. If you attend crowded indoor spaces on a regular basis, and if you have risk factors for severe health outcomes of COVID-19. So if you have existing comorbidities like heart disease, lung disease, cancer, all of those things increase your risk of developing severe complications from COVID. I encourage you, please come and get vaccinated. Factors that lower your COVID-19 risk is if you are fully vaccinated, that you mostly socialize outdoors instead of indoors, and if you have a small social circle. So again, please assess your risk and act accordingly. I think that's where I'm going to end my podcast today. I'm sorry that I had to be back here to give you guys another podcast on COVID-19. But again, the only way that we're going to get through this is if each one of us gets vaccinated. And so I really appeal to those of you who are out there who have not yet come in, please do so. I especially appeal to those under the age of 44 years. You are our lowest vaccinated population, and you need to come. And don't wait until it's too late, because I hate having these phone calls with families after the fact when somebody is sick or when somebody is hospitalized. So please come in and get your vaccination done. Thank you.